Right, good morning everyone. I hope you had a nice bank holiday weekend. Particularly thanks to those that were working, if there's anyone in the room that wasn't on over the weekend. Well, from what I can gather from the emails, there were a few unforeseen events of perhaps people not arriving when we're expecting them, etc. So well done to everyone. Right, so good morning. Team brief. So, starting off, hopefully everyone can see a copy of the brief. Starting off in the middle there, as we always do, the key messages from the board. The three key areas that we wanted to pull out really. One, I guess, kind of looking back, one looking to the sort of future in particular. So taking the first two, you just say a big thank you to everyone for last year, because although it might not feel like it now because we're into this year and it's now May and very soon it will be the summer, hopefully it'll stop raining. As we sat down, obviously it was our first board meeting after the end of last financial year, so what we do inevitably then was just have a bit of a look back, I guess, and I think last year was a really difficult year for everyone at the Trust, and indeed I'm sure for the patients and the families that we serve it was pretty difficult too. But for us, it was incredibly busy, busier than ever, more patients treated than ever. In that regard, some real challenges, particularly in the winter, but basically all year round. And whatever department you're working in the Trust, whether you're a clinical patient-facing department or a non-clinical department, if you like, that sense of busyness and that sense of what we want to do and what people that we want to serve is going up every year. So it was a very difficult year, but I think a good year, and to some degree, when we look at how other organisations did last year in the NHS, for a significant number of them, they struggled a lot more than we did. So through our hard work, we were able to, if you like, avoid some of the situations that other people got into. So I think that is a really big thank you to everyone and a big commendation for the work that everybody did last year. Looking forward though, as I think we've said a couple of times, it is difficult to see how keeping doing the things that we are doing now, even if we do them harder and faster and quicker, will get us to where we need to be going forward, especially if you look at the next 5-10 years. Despite everything that we've done, as I say, more patients every year, more challenge every year, so we will have to do a little bit of work, which we're going to begin over the May and June and into then summer and autumn, getting people involved in trying to have a look at where are we now in terms of some of the things that are obvious, some of the things that are less obvious, so we're trying to get some information that we don't normally look at when we say how are we doing. Sit down, get some people in a room and say, right, okay, what's the challenges of the future and what might we need to do differently going forward, and let's have some good ideas. And those ideas might not just be about us, they might be about primary care, they might be about secondary care, they might be about social care, might be about a range of things. So that strategic review, I think, is really important, and a really important chance for people to get involved at different levels in the Trust in shaping where we're going to go for the next 5-10 years perhaps. Third one there, message from the board, is just the importance that we put on patient stories. So we had a very good one at the board this time, and it essentially had a bit of everything. It had some very difficult, it was a lady who had a son who had come in for a procedure at the Trust, an elective surgical procedure, who had not had a good experience to start with, and therefore then had got particularly scared and then had to keep coming in for more procedures going forward. And it got worse in actual fact. But then what we'd done is we picked up on that, and we picked up on the issue, and then we'd listened and we'd try to do something about it. So I guess there was one with good news and bad news in the same patient story. So I urge all the staff, if you get a chance to have a look they're on the website. There are ones that are really, really positive. There are ones that are not so positive. The one we looked at this time, as I say, is one that had both positive and negative in it. So if you get a chance to have a look at those, it's a really important thing that the board do. We just wanted to remind people of that. We always start off the meeting with patient stories, and then we have a discussion about them and what they're telling us. So if you get the chance to do that too, there'll be something that we can all learn from them. In terms of some other messages, starting around the outside in no particular priority order, just to emphasise there around the cost improvement programme. We haven't done the final accounts yet, they're not completely signed off, but we will have delivered something like £20 million of cost improvement. And that is a very, very significant achievement. As I've said, to do that when you're treating more patients than ever and you're busier than ever is a fantastic achievement. And obviously an awful lot of people put a lot of effort into that. One, having the ideas, and then having the idea obviously is great, but you've got to deliver on the idea, and those things I'm very grateful to people for. Going forward, that challenge is there again, hence, as we've already talked about in terms of that strategy review, it's always important that whatever we do, we try to make the most of the money that we've got. Because if we don't, then we are letting down our patients and our staff. And what we are also doing is letting down the taxpayer in the country. Because if money goes into health, it needs to be used as best it can be. If it goes into education or anywhere, it needs to be used as best it can be. And that's difficult, because it's always hard, as I say, to come up with the ideas and then to make them happen. But well done to everyone on that. Going forward, we've got to keep doing it, because there will never be enough money in the pot called health to do what we want to do. I've never known there be enough money in 20 years in the NHS, and for some people in the room have got even more service than me, and they will know that never has been enough. So making the best of what we've got is really important. I'll do the financial update as well at the same time. I'll flip across the screen. Despite that really significant achievement, we did still end up the year in a deficit of around about £4 million. And going forward, although we haven't yet worked out exactly what the figures will be for this year, we do expect that deficit to get bigger, which is one of the reasons why we just need to have a look at that strategic review. Despite that deficit of £4 million, we did achieve, if you remember, Monitor have a rating that they give Trust called a continuity of service rating, 1 to 5. 5 is very low risk, if you like, 1 is very high risk, and we are a 2, and we were planning for that. So in that regard, we did deliver the rating that we planned for. Moving down to this part of the brief down here, Great Place to Work. We've established a Great Place to Work group to try and get staff involved. When you talk to people that work here, I think fundamentally this is a great place to work, and one of the things that often comes out of the patient stories, but obviously when you talk to people as well, is how proud people are to work here. But by definition, we need to try and make it better, and that's why we've got that group together. So there's been 2 meetings held so far. They've highlighted some areas where we need to look at their cultural change, effective leadership, recruitment and retention, which obviously is a very biggie for us. In the financial year just gone, we did actually do very well on, if you like, banking agency and locum use, but we know that if we can make sure people stay at the organisation, have the experience that they want, but also try and recruit more people in, we can fill that gap, and we can have more people in post, on shift, on the ground, but also reduce our costs. So that obviously is a very important one. But that open culture as well, in terms of how to challenge and raise concerns, and how to get proper team working, the kind of team working that we want, where everybody is treated well and is valued. So that's a really important part of it too. So groups of staff are working on that. There's Susan Taylor there that you can contact if you want to get involved, if you've got any ideas that you think that group should be looking at. So Susan's email address is there, and obviously you can give her a call too. Moving across there, strategic measures. One of the things that we have done at the board is we have something called an integrated performance report, which I think extends to probably something like 70 pages long, and has got all sorts of measures in, staff experience, infections, falls, length of stay, all sorts of information in there. And we try to look at all of those, but what we have done is pull out 10 measures. So the 10 are listed for you there. I won't read through them, but they pick up everything from patient experience, to pathways, to trying to care for people in the community, our financial measures, our estates, our information technology and how we use that. We've chosen 10, we're going to try and keep it to 10. Those 10 I'm sure we'll develop, and we'll get a bit more information out as to exactly what we mean by them. Because how you measure our estates, given that we provide services from I think around about 200 sites, it is a bit of a challenge. So we'll get some more information out, and as I said, it will develop in the year, but you can expect to see a bit more of those kind of measures as we just try and keep an eye on, out of these 70 pages that have probably got 2,000 measures in them, and where are the key areas that we need to work on as a trust. Healthy workforce, moving on to that. You remember that in the 5-year forward view that Simon Stevens released a few months ago, I can't remember exactly when now, one of the key messages in there was the importance of living healthily. And that's for the NHS, it's also for the country, it's for policy makers, it's for people that make decisions about food labelling or minimum alcohol unit pricing, etc. But for us as an employer, we are, I think, the biggest employer in Blackpool. We employ more than 6,000 staff. It's really important that we, and in a sense it comes out of a great place to work as well, that we try to focus on living healthily ourselves. And there's 2 reasons to do that. One is because it will be better for us as people. Second is that we'll set an example, and it will help us to give the leadership that we need to give. Because one of the things that when we look to the next 5-10 years as a country, we definitely know there are some things we could do, and I'm going to say we, I mean everybody, to live a bit more healthily, Not like monks or nuns. I was educated by monks and nuns and people like that, so I know something about them. Not like that, but a little bit more healthy. So that group's been set up. It's called A Better Tomorrow for BTH staff, and we'll be launching a website. There'll be an event on the 13th of May at 2:30, which will be a walk around the site. It's amazing what a walk, all the research shows that a walk midway through the day will make you work better, feel better, feel happier, be fitter. You get a bit of fresh air. You will, I've no doubt, wandering around here, you could bump into some interesting people. So that's one of the things that we'll start with, but as I said, that's part of the programme then as we try and build it up. So please do get along and get involved, and obviously it's a good chance to have some fun. And I know that there's a number of people that also all across the trust that are doing all sorts of things to just try and be that little bit healthier. And we as an organisation obviously need to have a think about our vending machines, what's in there. Not particularly healthy snacks, it has to be said. So there's an awful lot that we can think of as an organisation. Appraisals, the appraisal window's open and we're running until the end of August. This year's appraisal is shorter in terms of the content of the electronic system, and hopefully will give chance to staff then to have a good appraisal. We do need to document it. One of the strengths actually of this organisation is that we can document our appraisals without having to go and pull out 6,000 individual personal files and try and pull out bits of paper. But we've tried to improve that so you can do it in a more personal way. So please get your appraisals booked in with all your staff, and it's a really important chance to say thank you, well done, but also obviously to talk with people about areas that we need to try and work on, either as a team or as individuals going forward. Vanguard status is the biggest box on the page. I've started at the bottom actually, which is that if you get chance, it would be really good if you could go along on May the 6th, which is this Wednesday, to the Grand Round, which I presume will be in H. Petrie in the Lecture Theatre, where Andrew Webber-Byrne will be presenting the extensive care service, something that I've mentioned a few times, and you may well have thought to yourself, I wonder what he's on about. Go along if you get a chance and hear it from the man who has been really closely involved with actually designing the new service. We'll be starting it soon in Blackpool and in Lytham. It's a service that is focused on those patients that have some of the greatest needs, but who at the moment, the care that they get is a bit disjointed, a bit fragmented, often ends up defaulting into an admission to hospital when there would be better ways to do things. And for that patient and their family, they don't feel that care is wrapped around them, they feel that they're actually being chucked in and out of different bits of care in the system. So I think that is a really exciting development, and that's one of the key reasons why we've got Vanguard status, particularly for the Fylde Coast. So when we applied for Vanguard status, which was basically that they nationally asked for people that were working on new ways of working, that's one of the key things that we said we were going to do. So when people say what's Vanguard, well that is one of the major things that it is. We had a visit from the Vanguard team last week, having chosen the, I think it's 60-ish, the room is shaking their head, something like that, sites across the country, and they're now visiting them all. So they visited us in terms of the Fylde Coast last week. The visit went very well. It was a chance for us to go along and tell them what we were doing, what the CCGs are doing in terms of primary care, social care, how we're trying to bring that together. So we'll get some feedback from them. In terms of the £200 million funding that there is set aside this at national level, we are not aware of any of that resource that's coming to us yet, but as you'd imagine, when they came to visit us, we discussed with them the ways that they could potentially help us out. So hopefully we'll hear about that quite soon. And just to remind you as well that in terms of the North Lancashire area, the services that we provide, where we provide community and nursing services and lots of other things, that is also a Vanguard site. So up there obviously there's ourselves, there's University Hospitals of Morecambe Bay, there is North Cumbria Foundation, a partnership trust, there is Lancashire Care, and then obviously there are GPs, there are social workers, there are all sorts of people working, and that's the point, I guess, that all those people working together need to work together a bit differently and a bit better. There is a good plan up there to do that, and that's what we've got Vanguard status for up there. So there's nothing new in that regard. Hopefully what we'll do is get some extra support to allow us to do what we want to do, and up there in particular there is, I think, around about £100 million or so, looking at Wendy and she's not disagreeing with me, of capital funding. for new buildings, because one of the things that they haven't got in that part of the patch in quite the way we've got it in Blackpool are some of the areas like Whitegate Drive, the Lytham Primary Care Centre, Moor Park, some of those kind of facilities in the community that can help you. Obviously they're not a substitute for having people and services, but they can help you to do the things that you want to do. So that's an important part of what we're doing as well. So that's the brief for this week in terms of some of the messages or this month even that I wanted to get across.